Rate of COVID continues to stay below 1%, and a big reason for that is the vaccine.
So here to talk more about the vaccine is Carla Lally from Generations Family Health Center. Thank you so much for being with us.
Thank you for having me.
Carla, can you just first give us an overview about Generations, what kind of services you provide?
Sure. Generations is a community health center, and we provide medical, dental, and behavioral health services to people in Eastern Connecticut.
Yeah, so Willimantic, Putnam, Danielson, Norwich, all this. Now, right now, thankfully, the rates are pretty low for COVID in Connecticut. We've had a great success getting the vaccine out there, but we know there's some people who still haven't gotten it, might even be vaccine hesitant. How can you help?
So we've been putting a lot of time and effort into outreach efforts, question and answer sessions, going out to see our patients where they are, farms, schools, whatever needs to happen, just to help people feel confident in the vaccine and really understand the importance of getting vaccinated, that it really is our only way out of this pandemic.
And Carla, I love the fact that if they're not coming to you, you're going to them, which I think is really wonderful. Could you just dispel some of the myths around the COVID vaccine?
Yeah, sure. Some of the ones I've heard recently are concerns about fertility, which are false. There aren't any associated risks from the vaccine having to do with fertility. Sometimes I hear that it impacts your DNA, which it doesn't, and that it can give you COVID is another one. And really, it can't do that either. It doesn't. It's not a live vaccine. Doesn't contain the COVID virus.
Well, right now, a lot of people are concerned about the Delta variant, and this is perhaps a great way to protect against that, right?
That's correct. Mercifully, the vaccines that we have in this country so far are showing pretty good effectiveness against the variants that are out there. We have another variant in Connecticut that's more prevalent than Delta, but Delta is coming along, and luckily the vaccines that we have will be largely effective against those. So that's wonderful news.
And how do we get the shot? Where do we go? Do we go to the Generations locations?
Yes, you can go to any of our 4 sites. We have walk-in appointments, actually no appointment necessary in the mornings, 9 to 11, at any of our 4 sites, as you listed, Willimantic, Danielson, Putnam, and Norwich. And we're happy to give you the vaccine at any time during those hours.
Yeah, I think that's so important because in the past, people were hearing it was very difficult to get the vaccine, or you had to take a day off work, or all that. The message you really want to get out there right now is there are plenty of vaccines. Just show up. It's not going to take a long time, and you can get your shot.
Absolutely. It's a much different landscape than it was a few months ago. Much easier to get a vaccine, and we're doing everything we can to make it even easier. Very accessible. Just walk right in. We'll talk to you about it. We can answer your questions when you come. So come hesitant. That's okay. Come hesitant. Just come.
Just come, right? Exactly. Show up.
Yeah.
Do the people have a choice of to which type of vaccine they're going to want to get, or does Generations give a specific vaccine?
So we're giving Johnson & Johnson a one-and-done vaccine, which is fantastic. You're fully vaccinated after a single dose. But if you have reasons or concerns or questions about that and need a different vaccine, perhaps you have a child that you want to get vaccinated, we'll certainly help steer you towards places where you can access vaccines for those who are under 18 as well.
Oh, that's great.
And especially right now, we don't know when under 12 will happen, but 12 and up is you can get your kids vaccinated. And a lot of parents are wondering, should I not? This is really, if you get your child vaccinated, not only are you protecting the older adults, but as you head back to school, quarantines, not being allowed to do sports, getting that vaccine is going to help them get back to their life, right?
That's right. That's absolutely right. Like I said before, the vaccine is really our pathway back to normalcy, and children have suffered greatly this year. And so we want to get them on the same path back with us, back to a normal life, playing with their friends, going to school, and enjoying themselves.
And just one more myth, if you could bust it for us, altering DNA, that's not correct either, right, Carla?
No, I think, we've talked a lot about where that might have come from, possibly because some of the vaccines are called mRNA vaccines, but really, no, there's no alteration of your DNA that takes place after vaccination.
Well, terrific.
None whatsoever.
Thank you.
Yeah.
This has been very informative.
You're welcome.
Yeah, you have all
You're
the
welcome.
information out there,
Sure.
and it's a lot easier to go get a vaccine right now. You
So
can
is.
make a spur of the moment decision in the morning and just head on out there to find out more information. Thank you, Carla. You can go to www.genhealth.org. There's the information for social media as well. But it does make it easier when people can just say, oh, I got a free moment, let's go.
Absolutely. Please get the vaccine.